Good afternoon. Welcome to Grand Rounds today. Today I have the pleasure of introducing Jason Haglund. Jason received his undergraduate degree in psychology at the University of Northern Iowa and then received a Master of Science in Community Counseling at Gannon University in Erie, Pennsylvania. He holds multiple certifications, including being a certified mental health first aid trainer, and he has extensive experience in behavioral health care. We're quite pleased that he was able to join us today for Grand Rounds, perhaps made even more timely by last week's derecho. Today he's going to provide us with a review of wellness in rural communities and farm families, and please join me in virtually welcoming Jason Haglund.
Well, thank you very much. Good afternoon. Certainly we've all had to adapt greatly, and I'll tell you, there's nothing worse than just talking to people blindly and not be able to see faces anymore. So we're all adapting, aren't we? Feel free to use chat and use the chat function and ask questions as we go. I much rather prefer to have, conversations with folks as we go through these things. I blew right through that slide, but kind of, as we go through, I just want to have a conversation today about the extraordinary stress that we find rural communities under right now and the risk factors associated with that extraordinary stress that we're experiencing. Appreciated my background. I've been in the mental health space and addiction treatment and prevention space my entire career, but I'm also a farmer. And so my family, one thing my wife's done over the course of this summer with some extra time on our hands, we've done a lot of researching on Ancestry.com. And so I'm about 135 years in to my family farming. And so in 1899 was when my great-great-grandfather purchased his first land here in Boone County. And so it looks very different today, tilling the land and doing that. But many times farms are multi-generational. They've been passed through the land, and that creates its own type of stress and pressure. And so my son will be the sixth generation, and there he is last year sitting in the tractor. I'm sure if J.B. Haglund could see what farming's like today, he would certainly wonder what we were doing. Yields have exponentially gone up. So just to kind of put it in perspective, up until the 1930s, for corn, 30 or 40 a bushel an acre corn was pretty much the trend. Today, we push regularly 220 bushel an acre. So what we do as farmers and caring for the land, especially as grain farmers, is very different today. And so it takes on a whole different complexity, a whole different science, and a whole different level of financial risk than our ancestors ever had in the past. And so just to remind everyone, what is stress? I think we've all experienced stress over the course of the last 6 months in a way we never imagined. And so as we think about stress, is how we respond to any type of demand. And stress can be good. It can help our performance. It can help us to adapt. We just need to pay attention to how we deal with stress and pay attention to the impact stress has on us long term. I don't know if you can see, but the background of that picture is actually me sitting in line at our local ethanol plant, delivering grain this past December, trying to get grain delivered for a December contract that had to be delivered by December 31st. And I was getting ready to head out of town for New Year's. And so for me, that was stressful because I don't like going and sitting in line. And I especially don't like hauling grain, but I find myself doing those things. And so, was that a big stressor? No, not at all. It didn't have any long-term impact on me, but still stressful. And so we find ourselves in all types of different stressful events every day. We all do, and we all respond differently to stress. And so as we think about agricultural stress and stress in rural communities, we have to think about the extraordinary stress that farmers have on them. I think about weather events. People keep asking me how I fared in derecho. And my farm fared very well. We had very little impact from the storm itself. And, I just go 10 miles to the east, and there's cornfields that are flattened. One of the things, though, I know is my yields are being impacted because I'm part of a drought area. We haven't received hardly any rain for the last 3 or 4 weeks. And so our crops are stressed because of the rain. So farmers and ag-related businesses oftentimes have stressors of things that are extraordinarily out of our control. Everything from weather to the pressures of, I kind of talked about the multi-generational stress that, I don't want to be the fifth generation that messes this thing up, because we've been farming for 135 years. I think about the healthcare, and how healthcare is unattainable for many farmers, or the cost of healthcare is a serious consideration for folks who aren't able to access that in other off the farm occupations. And that's why most farmers have off-farm occupations, so they can afford healthcare and have a steady income. Remember that stress can disproportionately affect women, regardless of their role. Women are more likely than men to experience stress, especially in agricultural and rural areas. Typically, women play a supportive role, but may not necessarily get that support in return. And so I think about all these compounding factors of stress, and it really makes us think about then on how people react to that. And so as stress reactions increase, there's a much greater chance they'll become maladaptive and disruptive. And as I read more about our reactions to COVID-19 and how it's just exhausting to some extent. And so as we think about the disaster responses to derecho, we think about the disaster response to COVID-19 and the work that FEMA is doing and SAMHSA across the state of Iowa right now. We think about that this prolonged stress is much longer than what we're used to. And so we think about the prolonged stressors that occurred over in Glenwood and along the Missouri River after the flooding, and people were dislocated. And it really starts to help us to anchor in on just what a significant impact this can have, not only emotionally on people, but on their physical health as well. It's always good to kind of point out what are physical signs and indicators that we look for, especially in farmers. And so you see a decline in the care of farm equipment and animals, fatigue, avoidant. I've heard many stories of farmers who have been impacted because of the slowdown of processing especially of pork plants across the state or other meatpacking plants. And how, that there's been cases where farmers have just walked away from 3,000, 6,000 heads, of pigs in this example, where they said, we simply just can't afford to keep feeding them when we can't take them anywhere to be processed. And so, that is an extreme case of hopelessness and helplessness that they've put all their time and energy into raising these hogs to take them to be sold, and there's no place to take them to be sold. The backlogs simply don't allow that to occur, and they can't continue to purchase the feed to maintain those pigs any longer. And so, it really becomes highlighting of what that does emotionally to folks. And so we know pre-COVID, 1 in 5 adults in the United States suffered from some type of mental health condition. We also know that less than 40% of those needing mental health treatment ever sought out and received treatment. And so I think going into COVID-19, we had a serious backlog and difficulty identifying and appropriately treating behavioral health and substance use disorders. Unfortunately, over the course of the last 3 months and the initial research that we're seeing, that the implications are that things aren't getting better, that our emotional and behavioral health continues to decline, especially under the isolation and the pressures that that COVID has done, the disruptions of our day-to-day lives, that in some ways have been positive, but in many ways has been negative. I kind of always turn to the weekly pulse survey that's done by the United States Census Bureau alongside 5 other state entities. And the last data I could pull was July 16th to 21st. 38% of Iowa specifically reported symptoms of anxiety and depressive disorder. So to baseline that, we can go back to pre-COVID, January through June of 2019. The baseline's 11%. So, we're seeing increases. And if you look at this pulse poll week to week, it's steadily increased over the course since mid-June. And so as this data starts to roll in, we're able to start to see, substantial changes in people's wellness, substantial changes in people reporting depression and anxiety, which is good because we need people to talk about these things. We need people to talk about how they're coping or how they're not coping. Which again, access to opioid treatment pre-COVID was certainly something that we were very concerned about. I think post-COVID, we know that the implications for substance abuse treatment has not been great. I just saw Public Health here in Iowa put out some research just this week on binge drinking. Only 5 states had higher rates than Iowa when it came to binge drinking. 19.8% of Iowans reported binge drinking in the last month. So that was the month of June, I believe, is where that study came from. The Addiction Policy Forum reports 20% increases in substance abuse, and 34% of people in recovery reported that they had to change their treatment and recovery due to the pandemic. So I think access to care, although telehealth and other barriers have been taken away and eliminated, providing some access for folks who have high-speed internet, who have access to that, has been very positive. And maybe some folks who couldn't access treatment prior can access it now. However, it is still fairly gloom the accessibility that's available as we think about treatment options for substance abuse. Kind of for perspective, I always like to throw some just nuggets in there. The average farm size continues to decline. In 1840, 70% of the American workforce was farming. In 2017, only 1% of the workforce was farming. So farmers are becoming a much smaller and smaller club over the course of time. Although most U.S. farms are small, 90% of those farms are still operated by folks who are multi-generational, who count on that farming income and labor to be family. Only non-family farms only accounted for about 12% of total production. So although farms have become bigger, still primarily operated by families, which I think is important because that really tells the tale of kind of the fabric of Iowa and how so many of us are impacted by agriculture and agriculture-related businesses. Prior to COVID, financial strain and uncertainty was certainly something on everyone's minds. Farm bankruptcies were up 24% year over year. We continue to have trade agreement issues, record surpluses of grain, both soybeans and corn. Health insurance continues to be a struggle. Overall stability, has only been become more unstable, I guess, with the course of the recent weather issues, as well as COVID-19, as well as the cost of doing business is exponentially more today than it was just a few years ago. Farm income adjusted over time. And so this is in 2019 dollars, but we're in the bottom 25%, of income capacity And so we're not making a lot of money on the farm these days. On a return on investment graph, as you can see here, it's not a great thing to invest in right now. And so for some of us, sometimes we kind of question, what is it that we're really into? I think this kind of tells the story that farmers are really worried about mental health. Ag-related sectors are very much impacted. And so we think about, I do a lot of talks with folks in corporate settings, in ag-related business sectors. And mental health always comes up, that the impact of mental health on farmers is being thought about a lot. And a lot of times it's connected to financial stressors and that fear of not being able to provide for one's family, and the business just not being a model that works moving forward. 3/4 of farmers early on believed that COVID-19 would have a definite impact on their income, and probably COVID-19, along with trade agreements and other things, certainly decreased farmer confidence significantly over that same time. So we think about family impact and cumulative stress. It doesn't paint a rosy picture. So I do love to farm, but sometimes I feel like I get a little negative. So, think about what protects families from these types of things. And we know easy access to mental health care. We know building resilience, the ability to respond well to those disruptive shocks is really important. And so, over time, families have learned to bounce back. We're in Iowa, I've heard that on the news a lot. As we look at how people respond to the storm, how neighbors help neighbors, we have resilience and protective factors built in, but there's limitations to how far those protective factors can go, and that how are we taking care of each other. I call back to here's a picture of me on the beach in Hawaii in the late 70s, and so I'm the little kid there, and I remember traveling and doing all kinds of things. I don't remember traveling after 1983 because my family went through a bankruptcy, and so the ups and downs of farming in general, this is kind of just part of who I am. I understood their ups and downs. I didn't know at the time. I didn't understand it. I was too young. Why am I not? I'm used to spending birthdays in Disneyland, Disney World, and Hawaii, and now we don't go anywhere. I don't know what's going on, what's happening. Those things are all significant stressors, and so in my own personal background and upbringing, I remember those ups and downs, and certainly they have an impact on families and communities, and how people are able to cope with those things. 70% of U.S. adults with depression will never seek help. They'll never be identified or appropriately assisted in getting the right type of help at the right time. And although, I think the healthcare profession in general is doing a much better job with screening and identifying, we still have a huge awareness issue. We have an issue of people not recognizing their struggles as depression or anxiety. We see a lot of anxiety and depression co-occurring. The mindset stigma is very high, especially in rural Iowa. And so that stigma associated with getting help, of seeing a counselor, although we're seeing that start to decrease, is still a significant barrier to treatment. Even more so, the cost, uninsured or underinsured for behavioral health, and the cost of medications are very limiting. Of the Farm Bureau healthcare policies out there today, not one of them includes addiction or behavioral health care as a covered benefit. And so you have folks who are buying policies, trying to insure their families, and paying, $20,000, $25,000 a year in order to have an insurance policy because they can't qualify anywhere else, and still have limited access or no access unless they're paying 100% out of pocket. And then of course, access, are there the right professionals in the area that's willing to see you or that you're willing to get into? You know, the other thing that we have to take into consideration is without the access to treatment, being able to identify treatment, we also have the realities of suicide, and those rates are increasing significantly across the country right now. I lost my page. I was just rereading this morning. You know, the second leading cause of death for individuals 10 to 34 in the United States is suicide. Rural communities have much higher rates of suicide, and partly that's because of access to lethal weapons. It's not having access to appropriate treatment, the stigma associated with getting treatment. And so it's one of those things that we really need to have more conversations about. Suicide rates as well as opioid overdoses are continuing to increase. And part of that is fueled by the isolation and impacts of COVID. And so I really think as we think about rural risk factors, suicide is one of the top questions that I think about when dealing with folks who are under immense pressure and stresses and having difficulty managing. It's very closely associated as well with veterans. And so I always throw in this slide about those who have served in the military, because if when we think about folks who have served in the military and are veterans and are in a rural area, it really just continues to compound the risk levels and risk factors. And so, you know, in World War II, over 11, almost 12% of the United States population served in the military. Today, it's less than 0.5%. And so when we think about the exposure of traumatic events and PTSD, many of our returning veterans have, you know, it's the need is great to support folks who have served, and what that 0.5% of the population has experienced when they're in active duty is just so significant. And so when we look at the suicide rate of veterans, especially those veterans in rural areas, it really is exceptional. And, you know, I really hope that we can bring more light to that to support more individuals in getting connected to the treatment that they need. You know, the number one thing we can do to reduce access is to have the conversation. Understand that suicide thoughts will come and go. It's episodic. That someone may be suicidal when they talk to you, and by the time they get to the hospital, they may not be, because suicidal thoughts and intentions will come and go. And so what is it that we can best do to keep people safe? It's to educate communities, it's to educate families, it's to limit medications and firearms and learn other ways to cope and get help. It's always good to put in perspective where we're at. I always like to compare traffic fatalities because you hear so much, you know, about wearing seatbelts and doing things to be a safer driver. But we don't have near as many conversations, in my opinion, about how do we keep people safe, manage depression, take care of ourselves, wellness, and manage suicide. So, you know, I kind of did a comparison, and, you know, as of today, you know, typically there's 450 deaths per year in the state of Iowa, deaths by suicide. There are significantly less traffic fatalities. And today we really can't have that conversation without talking about COVID-19 and the impact that that's having on Iowans as well. So it's not all doom and gloom. Part of what we want to do is talk about what can we do about all this? What's the opportunity in what we have going on? And there's all kinds of new connections that we can make. I've been ecstatic to be part of some of the new connections that are happening, what resources that we have today that we didn't have, to see the resiliency going on in rural communities all across the state, and how many folks are starting to step up and break the stigma and speak openly about their mental health and wellness. I've seen rural Kiwanis clubs that, have 10 or 15 members that were having trouble getting people to meetings, that are now meeting online, doing Zoom meetings, and they're going to 10 or 15 different meetings all across the state and literally all across the country now, and connecting virtually. So people's social connections have changed significantly. And that's not a bad thing. I see a lot of folks who are making new connections and being more social than they were prior to COVID-19, breaking down barriers and walls. And so, certainly that's for folks who have the resources, have the connections. But I see my local Kiwanis Club is actually thriving during the age of COVID-19 because we have more people at our meetings virtually than sometimes we met at the country club in person. And so I think about all of those folks who could have been socially isolated, who could be feeling left out, who have found a place and who have developed a new skill set, and have now found a way to connect in a way that I don't think they could have even imagined they'd be connecting prior to the last several months. What can we do more of? We can provide more public education awareness. We can decrease means, reduce risks. We can implement screening tools, and we can all get behind doing suicide prevention trainings. And certainly, there's lots of different available trainings out there. I teach law enforcement. I do work with the crisis intervention teams, teaching law enforcement. Iowa State University, I partner with them in extension to do some stuff of identifying suicide. And mental health first aid is something Iowa State University does on a large scale. Iowa State University Extension also does it on a very large scale. And really, what is mental health first aid? It's a one-day course. It's now offered 100% virtually. We can connect with people. There's an online learning management system, and it really helps everyone to get on the same page and have a common language. One of the best things we can do is educate communities. And so the healthcare professionals, alongside law enforcement, alongside local clergy, alongside regular community members, educators, school professionals, if everyone has the same language, if everyone's talking about stigma, if everyone is getting on the same page, then we can have really great conversations about how do we support each other in the community, and how do we address stigma, and how do we decrease substance use disorders, and how do we start to impact suicides that have ravaged young people and older people alike in rural communities all across the state. And oftentimes, people don't know how to have that conversation. And the great thing about mental health first aid is it helps people to have the language to have that conversation. It can help medical professionals to have the language to have that conversation with people, so that it's easily understood for everyone involved. Sometimes we get so into the jargon, we get so into some of the detail that people don't understand. And so one of the things that we want to do as mental health first aid, and as we talk about all of the issues we started with, is how do we get everyone on the same page when it comes to understanding and supporting people who are suffering from a mental health condition. Mental Health First Aid 2.0 just came out this past June. So we're all learning a lot about what that looks like. We have the opportunity to do part of it online. There's a learning management system that walks people through the first couple hours. We now do virtually. The other half of the day, which takes on a whole different complexity of facilitating these types of courses. But it's been awesome because, just like everything, we have to adapt. We have to be there and respond to communities as they need this. And the way we respond today is going to be different. Certainly, we can still do these to some extent in person, but, I love to be in a room full of people and do different activities, but that all looks different today too. And so every part of what we do, we've had to rethink and redevelop. But what's important is the message. And what's important is teaching people how to respond and how to support each other. And part of that is just anchoring it in information, anchoring it in accurate information, and validating people's anxiety over talking about things like suicide, over talking about things like substance use disorders, over how to have a conversation with someone who you believe, a coworker or a friend that you believe is using substances and is starting to impact their life in a way that isn't helpful. When you start to see things in a neighbor that they're not taking care of things or giving away their belongings, what is it that you can do for that? As a teacher or a volunteer in your school, how do you help to educate others when you know that 1 in 5 children aged 13 to 18 will have a mental illness, knowing that generally most mental illnesses will show themselves by age 18. And also knowing that the treatment gap for most mental illnesses is on average 10 years still. So from the time someone first starts experiencing symptoms to the time they're appropriately diagnosed and treated, it's still on average 10 years. And so really mental health treatment lags behind all other forms of medical interventions. And I think we can do much better in general in being able to do that. And so we really want to be able to start those conversations. I do training at the Iowa Law Enforcement Academy. And so part of the conversation is 80% of the calls that our law enforcement partners will have will be mental health related when they're on the job. And so it's really important that we have those conversations and that community members are on the same page with their local police departments and sheriff's departments, because those men and women are out on the street managing things that in many times they haven't had a lot of training in. And so really looking at how can communities better support making a difference there, and how do we support the entire population. And so we know that there's specific differences in women. We know there's specific differences in men. We know LGBTQ plus populations. We know that subpopulations and minority populations all take on different risk factors. And so it's really important that we start to acknowledge all of those special populations, and we acknowledge that there are differences, and we all can have some understanding of that in general. It's good to acknowledge that 50% of new fathers will also experience postpartum depression, as do many women experience postpartum depression. My youngest is going to be a freshman in high school, but I can tell you when I had both of my kids, it wasn't the most joyous time of my life. They cry all the time and they're not verbal. I'm a talker, so I did not enjoy that time of my life, and I was bombarded with messages that I should be so grateful and so happy. No, I did not enjoy the first 2 years of my children's lives, and I still tell them that. And some people tell me I'm rude for saying that out loud. Well, clearly it was a transitional point in my life, and it was very stressful. And so a lot of people will have that stressful reaction during that time, and sometimes society doesn't allow that to be acknowledged as being a stressful time. And so it's good that we can reset and have those conversations. Mental health first aid in Spanish-speaking communities especially is important. I look across the state of Iowa, and there is actually a great deal of diversity. I look at what's happening right now in Marshalltown, Cedar Rapids, and we have huge populations of individuals, 30 or 40 different languages spoken in some of those communities and within their school districts. And so we really need to take into account our native population, Spanish-speaking communities. I think the second largest language after Spanish is Swahili in the state of Iowa, and thinking about how are all those populations supported, and what is really our cultural competence in understanding all of the nuances that we have to recognize within those populations. In general, I also think about you, and I think about not only mental health in the workplace, but I think about mental health within our healthcare system. We know from a lot of the SARS studies in 2003, some of the initial studies that came out of Wuhan, China, last January, that healthcare workers, in some cases, up to 70% of healthcare workers experienced PTSD or adverse stress reactions from treating patients or treating patients through the COVID-19. So when we think about our workplace, in your workplace, I think about how do you reach out to coworkers? How do you connect to a distressed person? How do you recognize signs? Sometimes it's so much easier with patients. And so oftentimes I have these conversations with professionals that it's much easier to have a conversation with a patient in a room than it is with a coworker that you're seeing has the signs and symptoms of things not going well. 70% of Americans with depression are in the workforce. And so I know you all have colleagues who struggle from time to time. We all struggle from time to time. And what's really important is that we have the empathy and the strength to help other people in their time of need and support them. And sometimes the best thing we can do is reach out and just let someone know, I'm here for you. How can I support you? How can I help connect you? One of the places where that's being done right now is through a FEMA grant, because Iowa is under a presidential disaster declaration for COVID-19. A second presidential disaster declaration is going to be coming for the weather-related events of the last several weeks. And so part of that is COVID Recovery Iowa. And so COVID Recovery Iowa is a great resource. You can access it by calling the Iowa Concern Hotline at 800-447-1985. And so I do workplace diffusions, stress diffusions. A lot of folks are still struggling from working from home. There's personal support. Sometimes people just need someone to talk to. We can also, as part of that project, connect people to other things. So they do a great job at COVID Recovery Iowa doing that. And that's just one of the many state responses to provide support to individuals. They also provide education in order to help people to learn about things like mental health first aid and to educate folks on how stress impacts them, how disasters impact them. And remember, the pandemic, COVID-19 is a disaster. And so the response from FEMA is no different than what we did along the Missouri River during that disaster. So I am also part of COVID Recovery Iowa in providing some guidance for ag and rural specialty populations. I always throw out there, remember the National Suicide Lifeline, 1-800-273-TALK. And there are specific things that are available to farmers, and Farm Rescue is a great nonprofit organization that you can apply to. And so farmers with cancer or other specific physical health issues or mental health issues, if somebody has to go to treatment during harvest and there's no one there to combine their crops, Farm Rescue is an organization out of South Dakota that they go around and assist farmers for a one-time assistance to be able to maintain their operations viably. And so it's just unique that there are so many opportunities and options that many people don't know about. So that's just a great group of people. And I always like to put things in a historical context. So, as I've done research on my family, I was reminded of the Spanish flu pandemic and the tornadoes that disrupted Boone County in 1918, which isn't that different. That's what's happening in 2020. And so history does repeat itself. And so we are resilient. Somehow my family made it through 1918 because I'm still farming the same ground that my ancestors were farming in 1918. So we made it through that. We know more today. And so I would hope that we can find other strategies and other ways to effectively manage today. So, as we kind of go away from here, I would love to hear some questions if anyone has any, or comments or statements. All layers affect each other. And, we know that disasters hit one area, they cascade through others. All sectors play an important role in behavioral health. And the more we can implement educational programming where we can get everyone on the same page, then we can create a uniform response. We can create supportive environments, whether it's within a workplace, whether it's within a community, and that can help to promote resilience. And it promotes resilience in not only adults, but our kids. And if we continue to promote that, then that wellness is going to extend well beyond our emotional wellness and into our physical wellness. Support is not a short-term solution. It has to be built into the long-term recovery. As we know, with natural disasters of flooding and tornadoes, and now land hurricanes, we know that there's a short-term burst that we go through. But just like with COVID-19, we're starting to realize how tiring that long-term support can be. And so although there's some things being put into place long-term, the long-term recovery from these things are going to be exhausting for many. And so we really need to think about, what are we doing for ourselves? How are we creating self-care plans? How do we talk about self-care plans? How do we talk with each other about self-care? How do we talk to patients about self-care? How do we talk to our friends and neighbors? What are you doing to take care of yourself? What are you doing? Just like we do with our physical health. I have no problem talking to someone about, well, how far are you running? What's your average time? But we don't seem to have the same ability sometimes to talk to people about, well, how are you taking care of yourself emotionally? What are you doing to manage the stress of all of the weight that's on us today with everything that we're juggling and trying to manage through? And the best way we can do that is using common language. And so, really thinking about the global concept of mental health literacy. Really, it's more imperative than ever that we're using that mental health literacy and talking to others about it. With that, I would love to take a question. I can just keep rolling on and on and on. But I'd love to hear from someone, or just to know that someone else is on would be great. Or jump on the chat. I can see there's attendees here. I don't know if you can be unmuted or.
Yes, it's automatically muted. But we have one question, or actually more a thank you. Thanking you for bringing this issue to light, since farmers don't get a whole lot of press. And another thank you saying that this was very informational.
Great. Well, hopefully it was helpful. See, this is where I'm much better with a conversation where I can see people. So there's certainly a lot of opportunity in the mental health space right now to educate and also educate ourselves on some of the things that we do not knowing that are stigmatizing and maybe hurtful to other people. I learn something every day about what I can do differently. So
well, thank you for sharing with us today.
I appreciate it.